Joining me now is Dr. Raj Kalsi, an emergency physician in Naperville, Illinois. Thank you so much for being with us.
Thanks for having me, Rosemary.
Now, of course, in the midst of this worsening coronavirus epidemic and pandemic, there's increasing concern that U.S. hospitals are not equipped to deal with any surge in patients and that there will be too few ventilators, masks, even medical staff. Now, you're there at ground level. How concerned should Americans be about that, and how concerned are you about it?
I'll tell you the pulse on the floor of the ER, and I'm speaking for ER doctors, nurses, patient care techs, registrars, people who are collecting your insurance information. We are all in the front line. We are scared. It is a measured fear because we are used to critical illness. We are used to the worst things. This is entirely new for everybody, but we are scared. Here's what we're scared of. We're scared of running out of N95 masks. We're afraid of the vacillating opinions on whether or not COVID is airborne versus droplet, and that makes a big difference. We're scared of going into a room where a patient doesn't declare that they have a cough. Perhaps they came in with abdominal pain, and they say, oh, by the way, Dr. Kalsi, I've had this cough since returning from my cruise, and that wasn't mentioned in the triage assessment. And we have kids. I have 3 kids. I have a wife who's a nurse, and we are fighting the fight. And what we worry about with future critical illness is exactly that. When we have filled our ICUs, Rosemary, with ventilated patients, the next critical wave of patients stay in the ER on ventilators until we can find a hospital where they can go to, but there may not be one. And we're afraid of an Italian experience, and it's quite concerning.
I totally understand. The thing that's mind-boggling is this is the United States. This is the superpower. How is it possible that this country is in this situation?
You know, and that's a great question. I don't have a great answer for that. I know that this thing with COVID, the pandemic, hit really hard, really fast at an inopportune time for America. Flu is just peaking, and all of the other typical fare, heart illness, pediatric illnesses, abdominal illness, cancer illness, traumatic illness is still going on. Nothing has changed with that. And organizations and infrastructure for the hospital system, medical system is prepared for our typical annual volumes, but we were not prepared for this corona illness and how quickly it's sweeping. I'm not a politician, I'm a doctor. I'm a lowly doctor in the ER, and I'm here to save lives, as are my peers, my nurses, and my brothers and sisters at all my institutions that I love and work with. And we are just trying to fight the fight medically. We don't really have a great opinion politically, but we want more support.
Well, as far as we're concerned, you are a hero along with all your colleagues. And we just heard from CNN's Dr. Sanjay Gupta about the important role that we all have to play in quarantining ourselves so we don't spread this virus. Let's just listen to what infectious disease expert Dr. Tony Fauci had to say about that same topic.
Don't get the attitude, well, I'm young, I'm invulnerable. You don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating. Please cooperate with us.
So Dr. Fauci specifically talking there about young Americans, about millennials specifically across the country still getting together at bars, restaurants, walking around as if this is just a normal day. Do you think U.S. citizens overall are getting this message about just how serious this pandemic is and how easy it is to spread?
Now, I certainly can't speak for the entire nation. I'll tell you, I live in a community where some people are still going out, congregating at social arenas, bars, things like that. I always tell my patients when I see them, even now, just yesterday night when I had a shift, I say, look, I have to create a tagline for them. Remember, I say social distance and we will go the distance. And they asked me what that means. I said, stay at home. If you have anybody you love, stay at home. You've come in with a respiratory illness. You've come in with a low-grade fever. The COVID testing will take days to come back. social distance, we will go the distance.
Dr. Raj Kalsi, again, we want to salute you and all other medical workers, doctors, nurses, everyone out there on the front line, because the work that you're doing is saving everybody and all our loved ones. Many thanks to you.
Thank you. And if you are a neighbor of an ER doctor or nurse, please just thank them and thank them for their hard work. And it is a courageous, courageous thing they're doing to go into work every day. Thank you, Rosemary.
Most certainly. Dr. Raj Kalsi, thank you.
Thank you.
We shall make sure we do that. And later this hour, Dr. Kalsi will answer questions from some of you about the virus, including hand-washing habits, and if people who have recovered from COVID-19 may still be infectious. Well, the pandemic, of course, can seem overwhelming at times and difficult to fully understand. And you, our viewers, have sent in some specific questions you have about the virus and quarantine measures. I spoke earlier to emergency medicine physician, Dr. Raj Kalsi, who answered a few of those questions. The advice is to wash hands with soap and water for 20 seconds. This is a long time. Most people only wash for a few seconds. If you wash for, say, 10 seconds with soap, is this less effective? Does it increase the chances of catching the virus? And are hand sanitizers any more effective?
You know, here's the thing. If you have a choice between inadequate hand washing for 10 seconds versus the 20 or 30 seconds, then use hand sanitizer. We need to understand our own weaknesses. We need to understand our own vulnerabilities. If you had a choice and you're on the go and you have to go take care of your kids or you have to go do something, use hand sanitizer and wipe till it's dry. But if you're going to wash your hands, do it effectively. Go between the fingers, rub both sides, and do everything you're supposed to do for at least 20 seconds. In fact, do it for 30 seconds. And this will make a difference.
Right, absolutely. And then this next question is the only way that the United Kingdom can stop or beat this to totally lock down like other countries so that the spread eventually stops?
You know, based on what we're seeing as doctors, and again, I'm not a politician, Rosemary, but as a doctor, it seems like quarantining is key right here. Here's why. One, we will not have enough data until probably August, perhaps even 2021, to really effectively understand what's going on with this virus. And next year we'll be way more prepared. That's scientific data. That's just how it goes. We can't understand this well enough as it's going on. Two, we know quarantining works. And it seems like some of the data from places that are more concentrated, cities in America, places in the world like Italy that are more concentrated, seem to have higher fatality rates, higher rates of infection. And that's just my ad hoc review of the data. I can't tell you for sure. I'm not an epidemiologist, but that makes a difference to me in how I recommend things to my patients here in the community.
And doctor, this next question, can people who are infected and have recovered still be infectious?
You know, with the evolving viral syndrome that you get with flu, influenza A or B, for instance, as you're resolving the illness, your rate of viral replication does go down, but there's a period of time where you're still infectious. We just don't know right now how infectious you are, one, when you are asymptomatic and you're carrying COVID. Two, we don't know when you reach a state where you're very low infectious rate and you're safe to be around elderly and people that are more vulnerable, or anybody for that matter. That's why we're putting in strict quarantines for a minimum of 2 weeks, because we are just estimating based on other data we have from other viruses that we know really well, like influenza.
And thanks to Dr. Kalsi for answering those questions.